हेलो फ्रेंड्स, वेलकम बैक टू माय चैनल एएमएस एजुकेशन। आज का हमारा टॉपिक है साइकियाट्रिक इमरजेंसीज, रेस्ट्रेंट्स, वायलेंस एंड लीगल पॉइंट्स। एक हाई यील्ड टॉपिक है फॉर नर्सिंग कॉम्पिटिटिव एग्जाम, स्टाफ नर्स एंड नर्सेस। So let's make it simple with example, visuals and mnemonics. So let's start the topic. Psychiatric emergencies are sudden disturbance in thoughts, emotions, or behavior that may endanger the patient or other. Example includes violent or aggressive behavior, suicidal attempt, suicidal ideation, severe agitation or panic, acute psychosis, substance intoxication or withdrawal. Violence management क्या रहता है? Violence management, so पहला हमारा है violence management. So when dealing with violent patients, de-escalation techniques क्या रहेगा? Stay calm, keep safe distance, use simple language. Environmental safety कैसे करेंगे हम लोग? Remove sharp objects, have adequate staff support, medication if required through tranquilizers like lorazepam, haloperidol. Last resort, restraint. So calm approach यूज करना है, रिमूव करना है डेंजर ऑब्जेक्ट्स को, स्टाफ सपोर्ट लेना है और मेडिकेशन देना है और लास्टली हम रेस्टोरेंट में जाएंगे. So the goal is safety first, protect the patient, staff and environment. Next हम देखेंगे restraints. What are restraints? Restraints are measures to restrict patient's movement for safety. Types है उसके physical, chemical, environment. Physical मतलब कि belt, straps का, mittens का यूज करना. Chemical restraints to control agitation like medicines का यूज किया था, like sedatives, antipsychotics. Environmental में locked ward या फिर closed door. And what are the principles of restraint? Use only when other methods fail. बाकी सब मेथड अगर फेल हो गए तभी हम इसका यूज करेंगे. Always get a doctor's written order. Restraints should be the least restrictive possible. Check करना है circulation, hydration, nutrition every 15 to 30 minutes. और document करना है everything properly. So this was about the restraints. It means measure to restrict patient's movement for safety. लीगल एंड एथिकल पॉइंट्स क्या क्या होते हैं? लीगल एंड एथिकल एस्पेक्ट्स आर वेरी इंपॉर्टेंट साइकेट्रिक इमरजेंसीज. पेशेंट के राइट को रेस्पेक्ट करना है. रेस्ट्रेंट इज द लास्ट रिजॉर्ट, नेवर यूज्ड फॉर पनिशमेंट. Always use ensure informed consent where possible. Under the Mental Health Care Act 2017, every person has a right to mental health care. No patient can be chained. Suicide attempt is decriminalized. Patient should get care, not punishment. तो nurses को क्या करना चाहिए? Document time, type, reason and monitoring of the restraints. So this is about the legal and ethical points. Now we'll see what are the 20 MCQ with rational. So first question is, which of the following is the first priority in managing a violent psychiatric patient? Administer sedative immediately, ensure safety of patient and staff, apply physical restraint, call security personnel. So answer है ensure safety of patient and staff. Correct answer क्या है? Ensure safety of patient and staff. Safety is always first priority before medication or restraint. Second है psychiatric emergency include all except acute psychosis, suicide attempt, severe agitation, controlled hypertension. Correct answer है controlled hypertension. Hypertension is not a psychiatric emergency. The preferred first-line approach in violence management is chemical restraint, seclusion, verbal de-escalation, physical restraint. Correct answer है verbal de-escalation. De-escalation techniques are always attempted first before the restraint. Which drug is commonly used to control acute violent behavior? Paracetamol, lorazepam, omeprazole, atorvastatin. Correct answer है lorazepam. It is widely used for rapid tranquilization. It is widely used for rapid tranquilization. Which of the following is a chemical restraint? Belt, locked door, haloperidol, seclusion. Answer is haloperidol. This is a medication used to control behavior for chemical restraint. Which is not a principle of restraint use. Use as last resort, use for punishment, obtain doctor's order, continuous monitoring. आंसर क्या है? यूज फॉर पनिशमेंट. इट इज नेवर यूज फॉर punishment. Which type of restraint involve restricting patient's movement using mittens or belt? Physical, chemical, environmental restraint, social restraint. So answer here physical restraint, which includes belt, mitten, and straps. In India, which act governs the right of psychiatric patients? Indian Penal Code, Mental Health Care Act 2017, Human Rights Act, Medical Counseling Act. Answer है Mental Health Care Act 2017. Suicide attempt in India under Mental Health Care Act 2017 is punishable offence, medical emergency, considered murder attempt managed by police only. Answer है medical emergency, not a crime. It is decriminalized under MHCA 2017. Which of the following is an environmental restraint? Lorazepam injection, locked ward, hand mittens, restraint. Answer है locked ward. Restricting environments include locked ward or room. During restraint, circulation should be checked every 1 hour, 15 to 30 minutes, 6 hours once a shift. Answer is 15 to 30 minutes. The nurse must document all except type of restraint used, reason for restraint, patient's favorite food, time of application. Correct answer is patient's favorite food. Documentation must be professional and medically irrelevant. Which of the following is an ethical principle in restraint use? Beneficence, maleficence, negligence, ignorance. Correct answer is beneficence. Restraint should be benefit patient and prevent harm. That is called beneficence. Which of the following is considered a psychiatric emergency? Catatonia, common cold, diabetes mellitus, arthritis. So catatonia can be life-threatening if untreated. So correct answer is catatonia. A nurse finds a suicidal patient with a sharp object. What should she do first? Call psychiatrist, remove sharp objects, apply restraints, ignore patient. Correct answer is immediate removal of harmful object. It ensures the safety. So answer is remove sharp objects. Restraint should be the least restrictive means. Options are use strongest method available, start with minimum restriction, always use chemical restraint first, restrain for longer duration. Correct answer क्या होगा? Start with minimum restriction. Use the minimal level of restriction is necessary. When applying physical restraint, the nurse should tie knots tightly, tie restraint to side rails, use quick release knots, keep patient unattended. So answer is use quick release knots. Quickly release knot ensure patient can be freed in emergency. Which legal body protects patient from inhuman treatment? Mental Health Care Act, IPC, Consumer Protection Act, Traffic Act. Correct answer है Mental Health Care Act. It ensures the dignity and human treatment. A patient in violent outburst is first given restraint, sedation, calm verbal reassurance, electroconvulsive therapy. Answer क्या होगा? Calm verbal reassurance. Non-invasive calming techniques are attempted first. In psychiatric emergencies, the nurse's first duty is towards physician, hospital rules, patient and staff safety, patient relative. Correct answer क्या होगा? Patient and staff safety. Safety is the top priority in emergencies. So this was about the topic psychiatric emergency and related top MCQs. I hope you like the topic. If yes, then please like, share and subscribe. Thank you.